Hello, Dr. Huffman from Florida Injury Centers. In this video, I'd like to talk to you about PTSD, post-traumatic stress disorder. We normally associate that term with military individuals who have been exposed to trauma of battle. My brother suffers from PTSD. He's a Vietnam vet. But it doesn't necessarily have to be a traumatic event in a military setting. It could be a traumatic experience in a home, in a car, other areas where you are traumatized and you continue to have these symptoms of flashing back, of remembering the injuries, of avoiding certain behaviors or people, changes in behaviors, changes in sleep patterns, hypervigilance. These are all symptoms of PTSD, and we see it in auto accident patients. It's rarely diagnosed because most people who are involved in an auto accident will go to the ER, urgent care, and they're more concerned about CAT scans and other imaging that has no real utilization in diagnosing soft tissue injuries or PTSD that you may actually have. So it's important that the PTSD symptoms are diagnosed on the front end of the case. If the physician you first see misses it, and later on it's picked up, the responsible auto insurer is going to push back on any PTSD diagnosis. I ask the questions on every patient. I'll give you an example of one patient I had. She was involved in an auto accident. Her children were in the car with her. They had to cut her children out of the car with the jaws of life, with big metal instruments to cut through the metal. The kids were fine, didn't have a scratch on them. The kids were fine. Mom, however, had issues. She couldn't drive the kids to school for the longest time. She couldn't get into the car. She would every time she was in the car, she was just looking left and right, ready for the next collision. She went through some behavior modification and training where she would drive into the country by herself and then drive on the highway by herself and take one child off into a slow country road and then on and on. So she worked through these difficulties, but many patients don't realize they have PTSD, don't get the appropriate diagnosis or treatment, and suffer with it for years. So don't suffer. If you've been in an auto accident, you have acute anxiety, stress, hypervigilance, insomnia, behavior changes, crying easily, don't hide it. Talk to somebody. Talk to a physician. Seek out a diagnosis and a treatment. Diagnosis alone is not as important as diagnosis and treatment. So if you have any questions, give me a call. I've been treating injured patients for over 35 years, and I've been diagnosing PTSD for about that long. Again, I don't miss it because I know the trauma it can have on a family. I came from a family with a member who had PTSD. So again, if you've been in an auto accident, get the diagnosis properly and early. If the individual physician you're seeing is not asking you those questions and you have those kinds of symptoms, hyperanxiety, hypervigilance, insomnia, easily startled, nightmares, flashbacks, you ask that doctor to refer you to a specialist. Thank you.